Hello, I'm Peter Hayward, Editor-in-Chief of the Lancet HIV, and as part of our Publishing Excellence course, I'm going to be talking to you about the different content types published in the Lancet journals. Now, across the Lancet Group, we publish a range of content with the end goal of publishing the best science for better lives. One of the great things about the Lancet journals is that while we have a core focus on cutting-edge research, we publish a lot of other content that really helps to contextualize the research and other developments in health, as well as entertaining our readers. To guide you through our content, I'm going to take you through a typical journal. But do bear in mind that each Lancet journal is different, and the content we publish does vary. It's that editorial curation that allows the editors of each journal to sculpt the content for their audience and to give each journal an identity while maintaining a general Lancet feel. Starting at the front, all our journals include editorials in which we aim to raise awareness of clinical and global health topics. These are written in-house by each journal's editorial team. They are the voice of the journal, and they let you as readers know what we are thinking on important health-related topics. All the journals also publish comments, which are opinion pieces like editorials, but written by external contributors. Most comments are commissioned by journal editors to help put research published in the journals into context, but spontaneous submissions are considered. These would be on topics relevant to a general medical audience for the Lancet or to the specialty title under consideration. These pieces can be about events unfolding in the recent past or near future, or other topics of current interest. We encourage submission of correspondence, which is often, but not always, in response to content in the journals. Many of our journals commission news pieces that are written by freelance reporters and sometimes editors. These pieces cover news about science, medicine, policy issues, and people. The types of the news piece published vary by journal, with some journals favoring long-form features and others snappier news updates. Perspectives is the Lancet's humanities section, and many other journals in the group have similar content that reflects on how medicine, science, and society interact. This section provides a different perspective on academic and clinical endeavors, and most of the content is commissioned by journal editors. Across the Lancet Group, we have a range of different review-type articles, from comprehensive clinical seminars to more opinion-based personal views and viewpoints. Different types of papers suit the different audiences of the journals, but all the journals publish reviews. For the article types published in the section by each journal, please refer to the target journal's information for authors available on our website. Review-type papers are often commissioned, but we do welcome inquiries, proposals, and spontaneous submissions. So if you've got an idea, please get in touch. Commissions are developed by Lancet editors in partnership with academic institutions. And in them, collaborative groups of authors take a thorough and expansive look at the subject of growing health importance with the aim of providing recommendations to improve practice or change health policy. Series include 2 or more review-type papers, take an in-depth look at a topic of special interest to explore new thinking that advances science, medicine, health policy, or health. These are typically led by 1 or more experts in the field in collaboration with journal editors. We don't take spontaneous submissions of commissions or series, but if you've got a proposal, we'd love to hear from you. Please reach out to the relevant journal, discuss with our in-house editorial team. Moving on to research, which is the backbone of the Lancet journal's content. And across the group, we consider most types of research related to health. As the strongest evidence, we have a preference for clinical trials of all phases, particularly more advanced phase 2 and 3 trials. For phase 1 trials, we want them to be of a novel substance or a novel indication, or for there to be a strong or unexpected beneficial adverse response, or a novel mechanism of action. We also consider systematic reviews, meta-analyses, modeling studies, and most other kinds of research relevant to clinical practice or global public health and health policy. Each journal will have a slightly different mix of research, but we do give priority to the best evidence. So clinical trials, intervention trials, large systematic reviews and meta-analyses, and prospective observational studies. Some of our journals do consider translational studies that are close to clinical implementation. Some journals will consider post hoc and retrospective studies, qualitative research, and case series and reports. We don't publish methodological studies or trial protocols. And that concludes my tour of the Lancet Group's content types. I very much hope that you have found this helpful. Do always remember that you can find more information on the lancet.com or individual journal websites, or by reaching out to the editorial teams. We look forward to hearing from you.